Hello, everyone, and thank you for tuning in to episode 60 of Your Birth Bestie podcast. Today, we are talking all about informed consent and us as women taking our births back. My goal for this episode is to empower you to be active in your care during pregnancy and help you see the side of obstetrics that isn't usually talked about in terms of questioning the status quo, or rather having information to know what you want, create a plan, and then take control of your birth, rather than passively following your provider's advice, maybe without prior education or information. And this isn't the case today, but the only way it's going to change is if we educate ourselves and each other about pregnancy and birth and change this expectation. So today I am sharing an interview I had with Katie Spinks. Katie has a large social media following on Instagram, TikTok, and Facebook, where she shares her story of uterine rupture after the routine use of pitocin for an elective induction. I was really interested in hearing her views as not only a birth doula, but also a mom who has experienced uninformed consent for the use of a birth intervention of pitocin mixed with obstetric negligence that led to her beautiful 4-year-old daughter, Jolene, to have a severe birth injury, which has affected her entire life, as well as Katie and her family in many ways. Hey there, I'm Beth Connors, a midwife and mom of 2, but also your birth bestie. In this podcast, we'll dive deep into everything you need to feel confident, prepared, and in control, from baby bump to delivery room, from practical tips to personal stories. We'll cover it all so you know exactly what to expect every step of the way. Let's get into it.
My name is Katie. I'm 35. I'm located in Northern Virginia. I have 6 kids. 4 of them are living. 2 of them are deceased. I lost the last 2 in my second trimester due to uterine incompetence because of all the scarring I had in my uterus due to the birth of my 4th child, which ended in a uterine rupture. I am currently a doula and a childbirth educator, and I landed in that work because of the birth of my 4th child. She was an elective induction. At the time, I was made to believe that inductions were safe. My doctor said, we do this to everybody. Everybody who hits 39 weeks is offered an induction. If you're low risk and you're healthy, then everybody does it. So with that information, I agreed to do it. And I want to say I was around 7, maybe 8 centimeters. My uterus ruptured due to the pitocin use. And a uterine rupture, as you know, is an obstetric emergency. There's just minutes for the team to assess the mom and get the mom back into the OR before she can die. She could lose her uterus, the baby could die, the baby could suffer brain damage. So my team did not do that. I went well over an hour pleading and begging for help, and nobody did anything for me. Even when the doctor came in over an hour later, the only thing she could focus on was my birth plan and the fact that I wanted to keep my placenta. So she focused on that the whole time as she's walking in the room. And then she assumed position and made me push through this rupture, even though with a uterine rupture, you can't push through them because the uterus is ruptured and the baby expels out to the abdominal cavity. You can't push with them. But she tried to make me. And each time I would push, I would pass out. So then she reached up in me and hooked a vacuum on, and then would pull the baby every time I would have a contraction, and it popped off 3 times. And at the 3rd pop off, I passed out. She stated in my medical records it was because I was tired, but it was because I lost about 3,000 milliliters of blood. So, it's over 40%. Wow. So by the time they did take me back to do the C-section, I was in emergency mode, and I had to have a 3-hour surgery to save my life. And Jolene, my daughter, was born completely purple. She had no heart rate, gave no effort to breathe. It took a few rounds of CPR, some epi. The doctor, thank God for the doctor who was there that night, because he started umbilical lines and started cooling her, because he knew that if she was going to have a chance at life, she would have to be cooled and slow her whole body down, which he did do that. And they had called for a transfer. The whole transfer team came there before I even woke up from the surgery, and she was transferred to another hospital that was about an hour and a half away from where I was. We were separated for like 3 days, around 3 days before we were united, because I had not met her yet. I saw her foot before she was transferred, and that was it. So because of all of this, because of everything that happened, because I didn't know that a uterus could rupture. I had no idea. And when I asked why it happened, they blamed it on me. They said, well, you must have a weak uterus. That's it. They said, this never happens. It's like a 1 in 1 million chance, and you just must have a weak uterus. But mind you, this was my fourth child.
Mm-hmm.
And she wasn't even my biggest child. She was actually one of my more smaller ones.
Yeah.
And so I just started digging more into it and realizing that what happened to me was absolute negligence, that women are not supposed to be treated like that. You're not supposed to hold a laboring woman's legs together. You're not supposed to tell them to be quiet. You're not supposed to tell them they're being dramatic. You're supposed to listen to them. That's the doctor and the nurses. It's their job is to listen. If a
Mm-hmm.
mom says I'm dying or something is wrong, they need to take it seriously. So when I realized that I was really mistreated and I was really lied to, it really sparked my interest into just kind of looking into birth work on my own. Like I was reading studies and listening to other people's stories and asking questions and just really getting out in the community virtually to see if other people had gone through this. And so eventually I was like, you know what? I really want to do this as a job. I want to be able to go into hospitals and help people and conduct classes and all that. So that's where it landed me into doing it professionally, because before last year, I was just kind of doing it virtually. Like women would come to me like, what do you think I should do? Do you have a study to prove this? My doctor's saying this. Do you think it's true? And all that. So I wanted to be able to put a title behind my name and be able to give them professional advice with the title behind my name.
Yeah, and I feel like that's how a lot of us come into birth work, is from having
Mhm.
an experience that, is less than ideal, that we've had trauma, that things didn't go the way we wanted to, and then later on we realize that something wasn't right. I can see a few parallels too in my own story of, I don't know how long it took you to kind of, I'm sure you felt like you were mistreated right away, but did it take some time for you to come to terms with what actually happened and be like, wait, the severity of the situation is much further than what I
Oh yeah.
initially thought? Because that's how
Yeah.
I felt with my first birth. It was months later, and I was like, that shouldn't have happened how it did. And
Yeah.
it's so unfortunate that it did.
At first, I really didn't like, and the NICU doctor even encouraged us to go see a lawyer. And I was like, it didn't click right away. Like, I don't understand why we need to go see a lawyer. Like, if this was my fault, it's my fault. So what am I supposed to do? And even it took a little over a year to realize that this really was not normal. The way I was treated was not okay. Not
Mhm.
okay, not normal. It was negligent. It was malpractice. It was all these horrific things. And like I said, I didn't realize it because they kind of shifted the blame to me. So I thought it was my fault. And you
Yeah.
don't realize it until later on, until you're processing it and really thinking it through. And you're like, you know what? This wasn't my fault whatsoever. None of this was my fault. This was their fault
Right.
completely.
Which is so interesting that you say, because you had three other kids before having your fourth kid, that you already had experiences before to bring with you. In general, like usually it's first time moms that they, have a birth experience, maybe doesn't go as planned, and then they are opened up, their mind is open to different opportunities and different possibilities. And then they're
Mhm.
like, wait a minute, things could have also happened better the first time. How can we make that happen? That
Yeah.
was my specific take on it, I guess, when I had my first daughter. But yeah, it's like, what can we do differently? And I would love for our families to have more information before they go even into that first birth experience, to be empowered and
Yeah.
informed.
I can't imagine being a first time mom and going through stuff like that because you are a first time mom. You assume you're going to go there, have your baby, it's going to be fine, and you're
Mhm.
going to go home. And they don't teach you in your prenatal appointments. Well, this could go wrong. This could go wrong. This means this. They don't teach you any of that stuff. So you just assume it's going to go good and you're going to go home. You don't think about any of the things that could happen in between. So I can't imagine being the first time going through that.
Right. And you have the trust in your providers. Like most of the time, they, of course, they mean well. They're in there to,
Mhm.
take care of moms and babies. That's why they got into it. And you just want to have this positive view of everything. But there is a lot of stuff that goes on, I feel like, behind the scenes too, of when you go in for an induction, it's more convenient for providers, or
Yeah.
when you get certain tests, we want to know as much information as we possibly can with certain tests, just because we can, versus because it's actually indicated for the medical necessity for a mom or for a baby. There's not always all of these things that we have to be doing. And then I feel like when we start doing all these interventions, they're doing all these testing. Families are kind of like, women in general are just kind of trained from the moment that they're pregnant that they always need to be doing something to make things happen. And I especially feel that in the end when moms are in their third trimester or they're, full term at 37 weeks, it's that conversation of, I'm not doing everything I should be to make things happen faster or to make my baby come, or why is she not here and I'm 39 weeks? And there's just not enough information or support around that time when we can go till 42 or beyond weeks pregnant in a healthy pregnancy and deliver a healthy baby and have a healthy mom without the need for things like an elective induction. And I just don't think that's really shared enough about.
I agree. I feel like everybody rushes birth now. Once 39 weeks hits, boom, everybody thinks that they should go into labor. And if they don't, they have to be induced. And I see women all the time saying, well, my doctor told me if I go past 39 weeks, my placenta will die and my baby will die. And it's like, it's just not true. That none of that is true. And if your doctor is using your baby against you, you need a new doctor. Your doctor should never use the words your baby will die, or you could kill your baby to induce you or to force you to do something ever. All of these interventions lead to more interventions, and then those interventions lead to more. And it's just this domino effect of one little intervention will lead to a much larger one. And we aren't given the information. We're not given the choices. We're not told the risks, the side effects. What could we do instead of doing this? Why do you really need it? Because, I mean, being in birth work, we know that if you're having an intervention done, there needs to be a medical necessity. That's how they should be using it.
Right.
Just like inductions. They were only approved for medically necessary reasons, not just because mom went to 38 weeks and her back hurts and she wants her baby out. Like, okay, that's just not best for the baby though. So,
right.
Well, I mean, doctors need to, I feel like some of them do. There are some really good doctors, but more of them need to sit down and they need to take control and be like, no, I'm sorry, Mrs. Smith, you're only 39 weeks. This is proven to be not safer for you. You need to at least hit 41 weeks, especially if this is your first baby. And we can give you options for pain relief. You can take this, or you can use this. We can put you on bed rest. There are things we can do to make you comfortable. But bringing your baby into the world because you're tired of being pregnant is not a legitimate reason. I feel like so many women do it. As soon as they hit 39 weeks, I'm so sick of being pregnant. Yeah. We all were 39 weeks. I think we all were.
Yeah.
But it's not like it's going to last another 39 weeks. There is an end. Once you get to that 42-week mark, it's a hit or miss. It depends if the baby's still healthy, mom's still healthy, baby's moving, placenta looks good.
Right.
Go another couple days.
Right.
But most of the time, women don't even make it that far. They hit that 41 and 3 and they go into labor. So most women don't even make it to 42.
Right. And that's a question I get all the time from families is like, what do I need to be doing now to, make things happen quicker? And what if I don't go into labor naturally on my own? And my answer for them a lot of the times is we just don't give enough time for moms to go into labor on their own to like show us that it's possible because we're trying to intervene too early. And I feel like that was more of the narrative that we should, support families, and because that's really all they need at that point. Like I've had so many moms reach out to me even at 41 weeks or 40 weeks that I've never met before. And they're just like, I'm really struggling. My provider is saying I need to be induced because, I'm 35 and I'm advanced maternal age, or just different things that maybe they're not technically like high risk medically, but there's like one little thing that they could pull from to say, well, we would recommend an induction today if you wanted one. And they'll reach out and they'll say, this is what I heard, but is this true? Or, do I have more time and things like that? And I think the support and just somebody to talk to, or if they're in pain, like having referrals to a chiropractor or go get a massage, or if you have other kids at home, maybe that's stressing you out a little bit and, you're done being pregnant at that point and you just need a break. And that will just change your mood around being pregnant still. If you feel like you had that expiration date, which due dates are not good for that mental mindset, I feel like either.
Yeah, I agree.
With waiting and having that date on your calendar and then it passes and then the next week passes and you feel like something's wrong with you, or you feel like something's wrong with your baby, or they're going to be too big. And all that stuff is just like made for us to believe versus actual factual things.
Yes. It's a race. They want birth to be a race. How quickly can we get you in and out? Or when when you have women in the hospital and the doctor's like, well, I have to leave at this time, so we really need to get your baby out, because if not, then you'll have somebody else. And a mom feels like, well, okay, she feels like she has to agree to receive a bunch of pitocin and things to speed up her labor. I think that's a terrible one too. I see that a lot. I'm gonna leave. My shift is over at 7. So if your baby
Yeah,
is leave by 7, you're gonna have somebody you don't know. And mom's like, oh my God.
right,
Okay. But it's like you
right,
don't get a medal for having a baby in 6 hours. You don't get a
right.
medal for having a baby in 12 hours. You don't get a medal for having a baby in 5 days. Birth is birth. It's supposed to
Hmm.
take a long time. It's not supposed to be
Yeah,
in in and out in less than a few hours. I mean, obviously some do, but it's
yeah.
not supposed to be. You're not supposed to force it like that.
And I think a lot of the stuff in the hospital with the intervention is all about being on the clock, whether that's cervical checks every few hours, or well, we can break your bag of water since you're here, why not? Or let's start pitocin because you know your water broke and your contractions haven't started yet, and it's been, I don't know, 12 hours or something like that. But then it's just kind of like, oh, well, this is usually the next step, or this is what I normally do with all my patients. And it's not that individualized care that families really need. And then it's also not that informed consent that we're given at all. It sounds like in your situation, were you given any risks of pitocin for your induction that you had a conversation
I
about that, or was it just kind
never,
of
never.
never?
My
Yeah,
doctor literally said that it's safe. We induce everybody. I'll be just like everybody else. I'll go in, start the pitocin, get the epidural, and go home. And,
yeah,
that was just the normal that I was taught. I was taught that you go in, you get pitocin, it gets too painful, so you get the epidural, and then you push your baby out and you go home. Nobody ever sat down and said, well, hey, there are some risks associated. They might not be common. Here are the less common ones. Here are the more common ones. If you get pitocin, this could happen. Um, it might lead to something else. And, nobody ever sat down and said anything. Nobody, not once, never. I've had 4 kids, pitocin with all 4 of them. Never once did anybody say anything. It wasn't until, like I said, when I was processing everything and realizing that it wasn't my uterus, was when I learned that pitocin can cause a uterine rupture, especially if it's at a higher dose. And I thought birth was supposed to be excruciatingly painful. I thought it was supposed to hurt like that. So
yeah,
I felt the pain of the rupture. And the nurse was like, it's just birth pain. I I just had no choice but to listen to her.
yeah,
Um, Even though I felt like in my head that something was still wrong, and I kept voicing that something was wrong, and it didn't feel like birth pain because like I didn't have pain in my vagina, and I didn't have this stiffening of the contractions. There was no rest in between. It was this constant pain, and it got worse and worse and worse. But they just kept saying, you're transitioning, you're getting closer, you're probably 10 centimeters. And I just kept telling her it just doesn't feel like birth pain. It
mhm,
feels like I got stabbed in my side. But no, nobody took it
yeah.
seriously, obviously, which is just very sad.
There was no like even option to get a second opinion maybe at that point, or overall you were just, that was your experience and there was nothing that you could do at that point. Was there anything looking back that you could have done differently?
Looking back, knowing what I know now, I could have demanded that they do an ultrasound, because they could have, they should have. I could have called 911 while sitting in the bed and tell them like I'm in a hospital bed and I feel like something is catastrophically wrong and nobody is listening. I could have called the charge nurse. Like there are things that I could have done to maybe make them listen. Well, at least try.
Yeah.
But who knows? I really don't know. In the end, if I had known then what I know now, I would have never agreed to the induction in the first place.
Yeah.
It would have never happened ever. But I just wish we would have known more that things could go wrong because we didn't even know that things could go wrong. I thought the only people who needed a NICU were preterm babies or really
Right.
sick babies or babies with cancer or moms who had, gestational diabetes or stuff like that. I was healthy and she was healthy. So it never clicked that there could be something else that could happen. I
Mhm.
think it's so important that women are taught these things can happen because you can't advocate for yourself if you don't know it exists. You
Yeah.
have no idea. I had no idea uterus could rupture, even though I'd had 3 prior children. I had
Right.
no clue. So if I had known that that was a thing, I could have used my voice and been like, I feel like my uterus ruptured. And I could have said that over and over. And somebody could have done an ultrasound. They would have seen that she was out of my uterus and in my abdomen, all the blood and everything. And things could have happened much quicker. But because I didn't know, and I just had to keep taking their answers of, oh, this is just birth pain. This is just birth pain. I didn't know what else to do.
it's important to have the information beforehand for sure. And then if something does feel off, or like even if it's not an emergency and your provider is telling you something that you just don't feel comfortable with, or your nurse is doing something you're not comfortable with, you have the right to say, I would like a new nurse, or go to the charge nurse, or not physically go to the charge nurse, but have to speak to the charge
Yeah.
nurse and just try to just knowing that's an option to talk to somebody else and not take what is being given to you as factual, I think is just eye-opening for families to know that there's not one way of having a baby. There's not one recommendation. Providers are going to recommend all different things. And if there's a question about literally anything, there should be an answer that's like specific to the concern, and you shouldn't stop
Yeah.
until you have an answer. Of
Not
course,
just
my first birth, I wouldn't have questioned anything. And had every intervention that you could have really based on an elective induction that I didn't even need, but I didn't know it was an option. It was just like forced upon me. And yeah, so it's just like not knowing that you have the option and not knowing that you can second guess your provider because you think that they're the expert, which they are. They've gone to school for a long time, but their way of practicing might not be the right fit for everybody. So
exactly.
that's important for everybody to kind of take away from.
Yes, definitely. I wish we had known to. I didn't know that you could fire a nurse and ask for a new one. You can also ask, like if you ask for an intervention, like say I had asked for the ultrasound and she said, no, you don't need one, then I should have said, or you could say, can you please document that in my chart that I asked for an ultrasound and you denied me one? Or, just if you ask for something or you're denying something, they can always just put it in the chart for documentation to show that you tried. I didn't know that you could do that either until afterwards. I think that's really helpful, especially with raising a child with such severe disabilities, is when I ask for things and they say no, you say, well, can you chart that? Usually they change their mind and they say, well, let's talk about it
Right.
a little bit further. They know that they don't have to just deny it. It might be a little bit more work for them to do something, like to do an ultrasound for me while I was in labor. It could have been more work, but it wasn't detrimental. It's not that hard. That's your job. You're there getting paid. You're getting paid anyway. So just do what you're supposed to.
Absolutely. Yeah. And feeling like confident enough to stand up for yourself. I think it's really hard. It was very hard for me as a first time mom, not feeling like I really
Yeah.
was prepared or knew anything to be like, who am I to say I don't want my water broken? Or who am I to say that I, want to be in this position as I'm laboring versus on my back with the monitors hooked up to me for the entire time. Like, I guess they've done this every single day of their life, as a nurse or provider, like who am I to say anything differently? But it's just so important for people to know that your experience doesn't have to be the norm or what everybody else is doing. It's everybody's
No.
body responds to labor so differently. And if you want to be hands and knees, like in the corner, like on the couch or whatever, like you can be over there. Like there's not this like
Yeah.
only section of the room that you're allowed next to the monitors, next to the computer that's convenient for them. Making the hospital room work for you, I think is important because I have a lot of families come to me too that they want like a home like birth, but they want to be in the hospital for that security. And I'm like, well, we can make that happen. We can make the environment
Absolutely.
different and you can have limited intervention or no intervention and just speaking up for that and feeling confident and prepared before going in to know what you're going to ask for and kind of hype yourself up if you have to. Not everybody likes confrontation, right? But there's a
No.
little bit of that and it makes a difference when you're ready for that.
Yeah, and it's hard, like when you're in a ton of pain, or you're in that vulnerable spot, like the laboring woman, but she knows she really wants something. So it's good to have somebody else there who can advocate to, who understands what she wants, when she wants it, how she wants it. So that way, when she gets in that transitional phase, where it's a little bit more painful, a little bit more discomfort, and she can't speak for herself, at least her partner or her doula, whoever else is there, can be like, hey, she said she really has a goal of not having you guys check her that much. She doesn't want you to increase her pitch. She doesn't want you to do this. She wants to be on her hands and knees. Can you help me get her in that position? Having somebody else there who knows that your goals and knows your wants and knows your needs is really important too. And the mom sitting down, I feel like with the doctor beforehand and at least giving them the plan so that way they know what they want in case they want to reference it. I don't know if they do, to be quite honest, but having that plan from everything you want from when you check in to the first stage, the second stage, and even the third stage, what you want for the baby, literally everything. It's really important so that way everybody can reference it and make sure that she's being respected in case, like I said, she's in that transitional phase, like my last mom. She handled her transitional phase really well, but she was very in tune with her body and her breathing, and she did not speak to anybody. I don't think that she wanted to talk to anybody, but between me as her doula and her husband, we knew everything that she wanted. So we could call the nurse in, have the nurse leave, call the doctor, and like do all these things for her to make sure her birth went exactly how she wanted. And she said because of that, because she met every single goal, it made her experience so beautiful that she doesn't have anything negative to say about it whatsoever. She said that she feels like she had the most beautiful birth out of anybody she knows. And like, that's what we want. We want everybody
Yeah.
to have a beautiful birth. Nobody deserves to go home feeling like, oh my God, I should have done this different. Or, oh my God, why did we do that? Or I wish I had done this different. Nobody deserves to go home like that because then it just sets in, with postpartum emotions and hormones and all that. It's just not healthy. It's not healthy at all.
Yeah, the preparation in pregnancy for the moment of birth, because you don't know what's going to happen. You don't know,
Mhm.
something unexpected is going to happen. You never know.
Yeah.
But having those conversations ahead of time and those like situational kind of plans of what would happen if just kind of also is like a important way to kind of let go and surrender to the process because you've already like
Yeah.
thought through it once before. So that when you are in that moment and you don't want to talk, other people have your back and you
Mhm.
can feel confident knowing that other people are there for you too. You've already made the decisions versus having to make big
Yes.
decisions
Right
like
in the middle of
right
it.
in the
God,
middle. Yeah.
awful.
I've had a few clients recently that have had really quick labors, and there's just not a lot of time to ask for things in the moment, that
Mhm.
knowing kind of their overall goal is really helpful. And when the support people are on board too, it's
Mhm.
you still can kind of facilitate what they want in kind of a chaotic situation. So I kind of recommend that for sure for all moms, is to have those plans
Yes.
and conversations, and how is your provider going to handle certain things, and making sure that you have confidence in their um, the way that they're going to handle the situation, which is harder in the hospital because you don't know who you're going to get as a labor and delivery nurse or as a provider, but being able to kind of navigate those situations, being prepared is much, much easier.
Yeah. And having somebody stand, either you stand your ground as the mom or having somebody else stand your ground for you
Right.
is so helpful too. Because if you have somebody who's like, oh, well, I guess, I mean, she didn't want that, but I guess, then that goes across or goes against her whole plan. And if she's really just zoned out, she's not going to pay attention. She's not going to know to
Right.
say no. She's just going to probably agree to it. And then that's going to cause another cascade of either emotion or physical intervention, which just isn't fair. Um, and I feel like also having a plan B to your plan A is
Mhm.
important too. Like even if mom wants a totally hands-off birth, no intervention, she wants to push in a squatting position. She wants to do everything like in a physiological process. But if she mentally understands, well, hey, if my baby starts tanking and really can't handle these contractions, maybe it'd be best if I did get on the bed and agreed to the continuous fetal monitoring and had a nurse by my bedside, that would be okay. Or if my baby really just starts tanking and the baby's heart rate is not okay, maybe a C-section would be better to keep from anything worse happening. Like having that mental note that this is the way I want it to go, but if it doesn't, I'm okay with this intervention and then maybe even this intervention. So that way you're not like slammed with these interventions when you don't want them or
Mhm.
don't know why they're happening. It's good to just understand who needs them, what they are, when it's best to use them, and have that little mental note like this could happen. So let me just be prepared just in case.
Right. That, yeah, the situational stuff, even with C-sections or when a vacuum or forceps might be recommended, those are scary words when you hear that
Yeah.
in the middle or at the end of your labor, middle of your labor, whenever, and you're like, wait, I never thought about that before. Like, what does
Mhm.
that even mean? Or why would I need that? With my first baby, they said I needed a vacuum, and I had been pushing for 4 hours on my back, and I just agreed to it because they said it was either a vacuum or a C-section. And I was like, okay, well, I'd rather choose the vacuum, I guess, because I don't want to be cut open right now.
Yeah.
But my baby was fine. I was fine. Literally just could have kept pushing, and I just could have asked for more time or just been like, well, I've been on my back for 4 hours. Maybe I should just try a different position. And that was never an option. Like these little things that can tweak your whole entire experience, because that led to different postpartum complications and postpartum pain and tearing and hemorrhage. And then because they did a vacuum, my baby had to be assessed for a certain amount of time with like the NICU staff and just stuff like that, that like was totally unnecessary for a healthy mom,
Yeah.
healthy baby. But if I would have just known better to just been like, no, I'm not interested in that. Everything's going fine, right? Like, why are you
Yeah.
recommending this versus just the time on the clock that says I'm a first-time mom that has been pushing for 4 hours. So I think there's just a lot of, yeah, there's a lot of things that you can prepare for ahead of time that you might not even realize with different interventions. You know, simple ones like an IV, or even in pregnancy, like, do I want the GBS swab or do I want a cervical check in pregnancy? Like, there's all these different things that are recommended and common and standardized, but they're not always the best for you as an individual. So yeah, that the information piece and the risks and having those conversations ahead of time, I think are just so vital to making sure that families have.
Obstetrics should be individualized, not everybody. Everybody is treated the exact same way. But we're not all the same. Like our body, my body doesn't mimic yours. Yours doesn't mimic your neighbor's. Like our bodies are all different, yet we all receive the exact same care, and we need individualized care.
Yeah.
And I don't feel like we're getting that. It's very rare I hear of a doctor asking a woman, specific questions or having an in-depth conversation or asking if she even wants something compared to, oh, here, we're doing this. It's very, very rare. We need to be treated as individuals, not as a whole, as a group. We're not all the same.
Right.
None of us are the same.
Right. And we're all comparing ourselves too as women to be like, what was her birth like? Or well, she had the elective induction and all my friends had the elective induction, then it's probably safe for me too. Or, I'm just gonna get this intervention just in case, I'm over 35 or I have a higher BMI based on a certain criteria or different things like that. I guess I'll just take the safer way, which is getting the baby out now because we know everything's okay. But it's also like, well, there's risks with the induction as well, or there's risks with these other things like scheduled C-sections or just different things that sound really controlled and great in the moment. And they absolutely could go that way, but they could also be very risky. So it's just, and everyone's different too with what risks they are comfortable with, right? Like,
yeah,
a risk for one person is not risky for another person, but I can't make that decision for people. That's something that they have to come to terms with themselves and their spouse and their doula or whoever, and making sure that it's the best for them. And yeah, you're right. That's just not the norm, which I wish it was for sure.
Informed consent needs to be like, I feel like a whole crash course during pregnancy in the second trimester. I feel like, because that's more your happy period of pregnancy. You're out of your morning sickness, the growing pains and everything like that. It's like your happy trimester. I feel like these crash courses should happen for every woman. Every woman deserves informed consent and should be given informed consent. If they're going to, whatever intervention the doctor uses or the hospital uses, they should sit down and talk to them, or even record something and have a mom take it home. Just something where it explains every single intervention, explain what it is, what the risks are, why they use them, who could benefit from them, who could possibly not benefit from them, why they would suggest it. These are the things that could happen from it, but we're only going to bring it out because of A, B, and C, like with fetal scalp electrode, have like a whole crash course on it. I don't think I've met one mom who understood what it really was. They said, my baby had a sticker on its head. Like, your baby did not have a sticker on its head. It was a screw, a little tiny screw that went in your child's scalp. It was not a sticker. And they're like, well, like what? So knowing these things beforehand rather than years down the road or afterwards is important. We need to be able to, when we're signing these papers, we're not really giving informed consent. We're giving consent, but we're not giving informed consent. There's a huge difference. You can agree to something, but not understand what it is or anything about it. Or you can give informed consent. You can understand what you're signing, why you're signing it. You could give off all the risks. You could tell them why you're receiving it and just list off all these reasons why you're okay with it rather than just saying, well, I guess, okay. I would rather say, okay, you can do this because I understand my child is at risk for hemorrhaging, or my child and I we're going to tank if I don't agree to this. So I'm okay with it, rather than just, okay, if you say so. There's a huge, huge difference rather than, or in between the both of those. Consent versus informed consent, two totally different things.
It's, yeah, shifting the control over to the mother or the family to make their decision based on the information that's given to them versus just going with the first recommendation that is the standard for everybody. But I think even if you are in a situation that you were not planning, whether that's, an urgent or emergent C-section, as long as you were on board and you were a part of that decision, it's like usually moms are like, that's the way my baby wanted to come and that's okay.
Yes.
And I made that choice versus, wait, what's happening? Why am I being rolled back to the OR? Like, is everything okay? Is my baby okay? Like, what's happening?
Yes.
There's a very different feel being part of those kinds of deliveries when we just talk to families as though they're part of their care and they have the decision, because you can say no to even an emergency C-section,
Mhm.
even if your baby's life is in danger, which is, an extreme case,
Yeah.
but like you can say no to anything. It's your body and it's your baby. And I just don't think there's enough knowledge about those really
Like,
strong choices that you
no.
have.
It's like they use all these policies and everything, and women think that because it's policy, they have to agree to it. And it's important for at least the nurse to be like, well, while this is policy and we do this to everybody, you can say no, and that's okay. We want you to make the decision. I think I've had like one group of nurses ever, one time ever tell a mom, this is our policy, but if you want to say no, that's fine. I'll just document it in my chart. I'm here for you either way. Either way, I'm going to give you the exact same care if you tell me no. And that's how it should be. It shouldn't change. Well, if you don't do this, your baby's going to die. Or if you don't do this, you're going against policy and something bad could happen. It should be, okay, that's fine. I'll put it in my chart. I'm going to give you the exact same care. Good for you for making a decision for yourself based off the knowledge that you have, rather than just the standard and the whole policy thing. It's policy, it's policy. Policy does not equal the law. And I think that it gets very misconstrued in there because women think that it's the law, but it's not. It's just the policy.
And it's the fear too of, well, what happens if I say no to this thing that is policy? What are they going to treat me differently? Or somebody going to call CPS because I'm not taking care of
Yes.
my child or something? And there's a lot of fear around that. So kind of preparing yourself too, if you are planning to do things a little bit differently, or your birth plan, goes against some of those mainstream hospital policies, is just equipping yourself with the knowledge to have those conversations. Like an example of that is like GBS. You can not test or test for it, even though it's recommended that you test for GBS at 36 weeks. I was tested for that with my second pregnancy. I was positive. My labor went too fast. I did not get the antibiotics. And then they treated me as if me and my baby were infected and we couldn't go home. And, they had to stay for at least 48 hours. And at that point, I had more information and I said, I'm okay going home at 24 hours. I had to sign a
Yeah.
bunch of paperwork leaving against medical advice. And had I not known that, I would have just been in the hospital an extra day. It wouldn't have been a huge deal, but like it was a huge thing for me to go home. My other kiddo was at home. I felt great and I just wanted to leave the hospital and be in my own bed and be at my house. So at that point, it was just they were taking her temperature every 8 hours and checking her respirations and things like that. But I
You
could do
can
that
do that at
myself.
home.
Yeah, I
Yeah.
could do that myself. And I had access to emergency medical care if I needed. I was very close to a nearby hospital. So that's the kind of part of like individualized care. Like if you want to go home, you should be able to go home. I trust you to come back if something XYZ is noticed. And let's just make sure the situation is the best for you versus like holding me there for a whole
Yeah.
extra day. Like, yeah,
You
it
can't
was
rest in a hospital at all. There's
no.
like bless their hearts. They're just doing their job, but
Yes.
hey, you fall asleep and then here comes Nurse Nancy. Hey,
Yeah.
girl, at 2 o'clock in the morning. I'm
Yeah.
just gonna yank on your uterus a little bit. I'm gonna turn all these lights on and wake your baby up. And then they
Yeah.
leave and they come back again 2 hours later. And it's like, I can't rest in here. I just had a baby. I'm exhausted. I need to rest. Every woman needs to rest. At home is the best place to do that. And
Mhm.
obviously, competent women, if you would just explain it to them, like, hey, if you're going to go home at 24 hours, this is what you need to look for. You can even get a pen and piece of paper, write down your baby's respirations, write down their pulse, like check how many wet diapers they're having, like do all these easy things that you really don't need to be here for. And I trust that as a loving, caring parent, you're going to come back if something happens, because 10 out of 10 times a parent will absolutely come back if they
Right.
see something wrong. And I mean, if like you said, if they're just checking the temperature or the respirations, like all of those easy things that you can literally check at home, then let them go home. There's no IV, no nothing hooked up. Home
Yeah.
is the best place for everybody.
Yeah. Exactly.
Best place.
Yes. Yeah. And that just knowing the choice that you are not held there or held to any standard of anything. Like there is so much more autonomy than is just like on the surface, I feel like. So I think it's cool that I'm meeting all these birth workers that are like you with these followings on Instagram that are sharing a lot about autonomy and informed consent and kind of changing the narrative, hopefully, with hospitals and just like mindsets that families can have a choice and be more active in their care because
Yeah.
that's going to change the maternity care so much.
The only thing that's going to change is if women start taking their birth back. The more they agree to just do what the policy is, nothing's going to change. It's when people start taking their birth back, start saying, no, sorry, you can do a hep lock. I don't want an IV. No, sorry, I don't want pitocin. I know my birth can take, 3 days. No, sorry, I'm not doing that. We've got to start standing up for ourselves. Got to have a good advocate. We've got to take back birth and show them that we don't want all this stuff. We're not okay with all this stuff anymore, or nothing's going to change. Our death rates are going to keep rising. The induction rates are going to keep rising. All these interventions are going to keep being normalized. Women who have no experience or no education in birth work are going to keep harassing those of us who do and saying, your doctor knows more. Your doctor. Like your doctor, yeah, they did go to school. They're an MD. They do have a lot of education. But the difference between an obstetrician and a midwife is for physiological birth. They understand physiological birth. They know it produces better outcomes. And the obstetrician is a trained surgeon. They're there for an emergency, for high risk patients. For the low risk mom, a midwife and a doula is a much safer option. It's just, I think women need to get comfortable with saying no, or saying even no thank you, or even saying I respect your education and I respect your professional opinion, but that's not what I want from my birth. Until we start saying no, our numbers are just not going to change. All we can do is just keep educating everybody. The ones who want to learn, who want to listen, they'll listen. And it'll help them. It'll help them a lot. I've helped so many women just virtually, just from sharing what I do, who are pregnant and they use all the stuff that I share. And then they come back when they had their babies and they're so excited. They're like, my birth was so beautiful. Here's pictures. This is how I did it. Like, this is all the things I was able to deny because I understood why I was denying it. And it's a wonderful thing because, without social media, we can't share all these things and nobody knows. I would have had no idea that I was not the only one with a uterine rupture if social media wasn't a thing. Because I honestly thought, like I said, they told me I was like 1 in a million. I was like, there's going to be nobody else in the world besides me with this. But I learned that there are thousands and thousands and thousands of others. So it's just, I feel like social media is a very important part of birth work too. For the trained person. There are some crazy people out there who share some wild stuff. But you just gotta keep trying. Gotta keep trying for the greater good.
Thank you so much for tuning in to Your Birth Bestie podcast today with Katie Spinks. You can find her on Instagram and TikTok, which I have linked below in the show notes. And I also wanted to remind you that I have a free download if you haven't checked it out already, but it's called Understanding Your Hospital Birth Options for an Informed Birth Experience and can be downloaded for free at bethconnors.com/choices. This is my #1 downloaded resource, and I really think you're going to love it, hopefully opening your mind to some options in pregnancy and birth that you probably didn't even know about, and that most providers don't really have time to dig deep into during prenatal visits, but are still important for you to know that you have a choice. As we talked about in this episode, maternity care should not be standardized like it is with constant medical interventions. It should be women-centered, and I would love to see more moms engaged and taking control of their care with the collaboration of a professional. You have more say than you probably think you do. It's just a matter of having the information and the confidence to know what choices you have and actually advocate for yourself. I am confident that you can do just that, and I am happy to be a resource for you also throughout this entire journey. Thank you so much again for being here, and I will be back again next Tuesday with another episode. Bye, everyone.